Welcome to the Stanford Medicine Alumni Association's Alumni to Alumni Speaker Series. My name is Jennifer Cobble, and I am the Executive Director of SMAA. This series features accomplished graduates of the Stanford School of Medicine as they share their knowledge and experience in a variety of healthcare, research, startup, and private sector settings. With these presentations, we hope you'll gain a better understanding of the diversity, innovation, dedication, and impact of the many alumni who represent the Stanford medicine community as leaders in both medicine and the biosciences. Before we begin, I'd like to remind you all that your microphones and visual profiles have been set to listen-only mode. Only the speaker and myself as moderator will be visible on your shared video screen. Should you encounter technical difficulties, please try leaving the webinar and logging back in again. If issues persist, you can reach out to us at medalumni@stanford.edu. Finally, we will take questions at the end of the presentation. You can submit questions anytime by using the Q&A feature at the bottom of your screen. If you see a question similar to your own, you can like it by clicking on the thumbs up icon, and that question will move up in the priorities. Given our large audience, I apologize, but we may not be able to cover all the questions in our allotted time. So now I'm pleased to begin our session on medicine in the bubble, the NBA and COVID-19 with Dr. Leroy Sims. Dr. Sims is a physician who is board certified in emergency medicine and primary care sports medicine. He is currently the Vice President and Medical Director for the National Basketball Association. He also practices emergency medicine at Mills Peninsula Medical Center in Burlingame, California. Dr. Sims graduated from Stanford University with a bachelor's and a master's degree in biological sciences. He received his Doctor of Medicine degree in 2007 from Stanford University's School of Medicine, during which time he was also awarded a Howard Hughes Medical Institute Fellowship. He completed emergency medicine residency at the County Hospital at Harbor UCLA Medical Center and went on to complete a fellowship in primary care sports medicine, again here at Stanford University School of Medicine. Dr. Sims represented the United States Olympic Committee in the 2016 Summer Olympic Games in Rio de Janeiro, serving as team physician for the USA track and field team. He's been a team physician with USA track and field since 2013, staffing multiple domestic and international events. He was previously the medical director and team physician for the NBA Golden State Warriors, and his sports medicine career began here at Stanford University, where he was appointed as a clinical assistant professor in the Department of Orthopedic Surgery and also served as medical director for Stanford University's football team, including 4 consecutive BCS appearances. Woo-woo! He also served as head team physician at Stanford for multiple sports, including track and field, women's soccer, women's gymnastics, wrestling, and women's tennis. In his role with the NBA, Dr. Sims is responsible for the organization and provision of medical care at all domestic and international NBA, WNBA, and G Leagues events. He coordinates medical care with hospitals, physicians, first responders, and other key on-site partners to ensure optimum medical services at all NBA events. Please welcome Dr. Leroy Sims.
Thank you very much for that introduction, Jennifer. It's really, really an honor for me to be here. To be addressing my alma mater is really a dream come true. I know that Stanford is just an institution full of accomplished individuals, smart individuals, And so for me to be able to share that stage is really just a plus for me. And so I'm very honored and privileged for this opportunity. So I would like to start by saying thank you to the Stanford Medicine Alumni Association, Jennifer Cabo, and the Board of Governors for this invitation to present and to be here tonight. I'd like to also thank the Stanford School of Medicine and Stanford University faculty and staff. You all have educated me. You all have nurtured my academic and professional development, and I owe a lot to you. And you all know that wherever I am and wherever I go, I represent Stanford hard. And it's because of you, so thank you. I'd like to thank the Stanford Alumni Network. Whenever I need an expert on subject matter, when I need a recommendation, when I have a medical question, my first go-to is Stanford. I always turn to classmates, faculty, whoever I know at Stanford as the first go-to for anything that I need. So I thank you all. I'd like to thank my classmates, my friends, my colleagues, my family. I love you all. You all support me, you hold me up, you nurture me, you give me constructive criticism, you laugh at my jokes, and sometimes you laugh at me when I tell jokes. So thank you all. I'm going to spend some time tonight talking to you all about this experience and this experiment, the NBA bubble, and go through what the process was like in developing the medical protocols and operationalizing what ultimately is leading to us being able to resume our season and carry on the playoffs and hopefully crowning a champion and a little more than a month away. As it relates to this talk, I have nothing to disclose. There are no conflicts of interest. I'm not being compensated by any of the companies that I will mention or any of the technology that I speak of. No one's paying me for this aside from the NBA. So nothing to disclose there. If I do have something to disclose, it's this. I'm right now in Orlando in the bubble. So if there's a crisis or an emergency, I might have to jump off this presentation and tend to it, but I think I'm going to be good. So this is an overview of what I'm going to talk about over the next 20 to 25 minutes. I'll start with creating the bubble, how we got here, and then define exactly what I mean, because this really isn't exactly a bubble. The nomenclature is a little bit off there, but I'll define what our campus is like. And for the sake of this presentation, I will call it a bubble, even though it's not exactly hermetically sealed. I'll go through what our health and safety protocols are on this campus and what we are doing to make sure that everyone here is safe and that the game of basketball is able to go on. And then I'll wrap up talking about the campus experience and really highlighting how all of these different pieces of our health and safety protocol and actions come together to be able to get the players on the court and our staff in the building for the basketball game. So first, how we got here. I'll start on March 11th, which is when one of our players, Rudy Gobert, tested positive for the coronavirus. Remember, at that time, it was we were in a very different state in the United States. People weren't wearing masks. We hadn't gotten quite to the shelter-in-place protocols that we eventually saw. We weren't testing the way we are now. Things were just different. So when you have a player who tests positive, the first thing you have to worry about is who else could be at risk. And in the context of basketball, where players are face-to-face, very close, there are 10 people on the court, they're around coaches, they're around referees. We knew that we had to look backwards somewhat. Who did Rudy Gobert play against in the days leading up to that positive test? And we had to hit stop, and we had to do our due diligence. We had to be thoughtful and look out for the health and well-being of the players. You hear that said all the time, it's primary, looking out for the health and well-being, but that is what we do. That's what's important, and that was our charge. But even in the context of that day, leading up to March 11th, even in the Bay Area, Golden State Warriors were dealing with a decision from local government about whether or not they could have fans in the building in the days leading up to that positive test. So the world was starting to change, and we hit pause. So what we did from that point was we had to think through, could we resume our season? If we were going to resume our season, what would it look like? Were we going to pick up with the rest of the season? Were we going to go straight to the playoffs? Were we going to try to do it in individual cities? Likely no, because different parts of the United States and Canada were in different places. Some places weren't allowing gatherings, some places were. So we knew we were up against it and had to think through what our strategy would be. For my part, on the medical side, we knew that one thing that we were going to have to do was to test. So calls started to go out. I reached out to some of my Stanford connections, to get introduced to some chief medical officers at organizations. We talked to various testing labs. We talked to BioReference Labs. They're a large nationwide tester. We talked to Quest. We talked to LabCorp to get a sense of who could do testing for us. We have 30 teams in 29 different markets, and knowing that we would need to test broadly across the United States, we had to find out who could do that testing for us wherever our teams were. We also talked to the manufacturers of these testing platforms. So we did speak to Roche and Abbott and Thermo Fisher. We talked to Cepheid. We talked to ClickDX and Visby. All of these companies to find out, what are your tests like? What can they do? Are there any supply chain issues? What's the data saying about these tests, knowing that we were going to use these tests for asymptomatic individuals in surveillance, as opposed to those who, in general, come to a medical institution looking to get a test because they're symptomatic and then looking for confirmation. So we had those conversations, and those worked out very well. We reached out to lots of experts, infectious disease, epidemiology, industrial hygiene, to get insight and input in terms of where we should go and to vet what we were doing. Dr. David Ho was one of the experts who we turned to. The NBA had a relationship with him going back into the 90s. He consulted on the Magic Johnson case, and he was someone who was one of our first contacts. But we went beyond that. I turned to Stanford. I called up the person who taught infectious disease when I was at Stanford, Dr. Julie Parsonette. I wrote her and I said, hey, this is what's happening with the NBA, and I could use your expertise. And sure enough, she introduced me to Dean Winslow. And Dr. Winslow is a consultant right now for the NBA. He got our health and safety protocol when it was 13 pages long. It went on to 45 pages, and ultimately to the 113-page document that it became. And he helped us all along the way, analyzing it, vetting it, giving contributions, and really, really was helpful. In thinking about the people we would have on the ground, we knew at some point we would have pediatric guests on the campus. So I turned to Dr. Bonnie Maldonado and Dr. Manuel Amieva, pediatric infectious disease specialist. I turned to Dr. Monica Weimer, who's a pediatrician, trying to find out, what do you do when you're testing kids? How do you test? How frequently do you test? And on and on and on. I made such good use of my network. I called up Dr. Anil Menon, who's leading the medical team at SpaceX, knowing that he was in the process of looking for testing for his organization. Who are you looking at? Who are you talking to? What are you doing? And then as a whole, with the NBA, we talked to other leagues. We talked to the NFL. We shared information with Major League Soccer, MLB, the Bundesliga over in Europe, UEFA Soccer. We reached out to everyone we could, sharing information, getting information, trying to figure out what they were doing and what could we use to build the most robust medical plan that we could. And so what I want to point out is that this effort to have this game, to have our bubble, was collaborative. There was a lot of work, a lot of calls, a lot of times that went into what we did, but this wasn't a singular effort. This was a major effort. And at each step along the way, the National Basketball Association had to be in lockstep with the National Basketball Players Association to have that agreement and buy-in, because we couldn't have a protocol that was in place that the players weren't going to agree to and say, hey, okay, we'll come to your bubble and play. So we needed that buy-in as well. We looked at various locations around the United States to see where we could do this. Las Vegas was a popular option, and part of that is because we go to Vegas every year for our summer league. We go there for our G League showcase, and we've done multiple events there. Vegas has lots of hotels. They have sports spaces, and that was an area that we thought that we could pull this off. We looked at Chicago, Houston, but ultimately we landed on Walt Disney World. Disney is one of our biggest partners. And so it made sense for us to do it here. And once that decision was made, we moved forward. I started making contact with healthcare networks on the ground. Advent Health has been our biggest partner here. And we moved forward with our plan to have our bubble. One thing I want to talk about before moving forward is the social responsibility aspect of the NBA. There's always talk about NBA players jumping the line, getting the best, and getting things that other people don't have. The NBA is very cognizant of what we do, and also cognizant that we want to make a contribution to the community. And so as we were having these conversations with Quest, with BioReference Labs, and thinking about how we would do our testing program, one of the things that was directly stated to me was this: wherever we go, however we test, we are not going to do it if we are going to be a burden or a detriment to the local health community or the community at large. So as we talked and made contracts about testing, we made sure whatever we were doing, we were adding to the community. If we're going to test, we're also purchasing tests. The NBA launched NBA Together to help communities that have been impacted by the coronavirus pandemic. The NBA Together campaign has raised over $100 million that have gone towards supporting salaries for part-time arena workers, has gone to support healthcare workers and vital services throughout the country and internationally impacted by this pandemic. We've donated PPE, over 10 million PPE, including from the Brooklyn Nets alone, 500 ventilators in the New York City area when they were a hot spot. In terms of testing, we've donated and contributed and done testing campaigns, tens of thousands of tests. The Denver Nuggets alone have contributed 25,000 tests, coronavirus tests in their community. And we charged each team to make a contribution where they were. And now that we're here in Orlando, we have done community-based testing as well. So I really wanted to just take an opportunity to highlight that work that we do and to let you all know that it is important. That is something that came from my time at Stanford, thinking about the Arbor Free Clinic and the things that we do, the pipeline, giving back. As much as I went forward in my career, I always made sure to look back, and that is something that I am proud to say that the NBA does very, very well, and I'm glad to be a part of that. So let's define the bubble. What do we mean by that? Here we are, we're in Orlando at the Walt Disney World campus. It's not quite a bubble. Really what we have is multiple pods, but these pods are very well controlled in terms of access. The teams, there were 22 teams that came down, were spread out across 3 properties. The primary property that we have is the Coronado Springs Resort, and we have that exclusively to us. That houses 8 teams, our NBA staff, some of the media, and others. We have the Grand Floridian Resort and Spa, which housed 8 teams, and we had the Yacht Club, which housed 6 teams. In terms of playing basketball and practicing, we had multiple practice locations. The Contemporary Hotel Convention Center, we had multiple courts that were laid down there. And the Coronado Springs Resort, where we are right now, has multiple practice courts that the teams use. But our biggest sports complex is the ESPN Wide World of Sport complex. We have 3 broadcast courts there in the arena, the Visa Center, and the Field House, and multiple practice courts that are in those venues. Each of those venues you can only access with the appropriate credential. And if you have it, you can get in. If you don't, you can't. Our credential system is pretty robust. A green credential signifies that you're someone who has gone through a quarantine process. You're being tested daily. You're a part of our daily health monitoring process. The green and yellow credential is specific to Disney workers. They're called cast members. The cast members are people who enter into the bubble, but they don't stay. They end up going home at night. And so we needed a special designation for them. And the yellow credential is for those who are staying outside of the bubble. So I talked about the venues that we do have where teams and staff are staying, but we have others who are outside, staying at the Wyndham or the Waldorf. And those are people who never need to come into contact with players. For instance, those who are involved with the broadcast, out in the broadcast compound and getting the game off visually. On the back of the credential is a QR code, which gives you access to what has been referred to in the media as a snitch line. If you see people who are breaking the rules, you have a way to notify security of things that are going on. And so really cool, complex credential system that we have, and that helps determine where you can go. Here's a quick overview of what some of our campuses look like. Coronado Springs Resort, we have a perimeter. It's being watched both by foot patrol and by camera. Lots of spaces that we restrict where certain people can go. Some people have all access, some have more limited access. We have the housing towards the top of the complex, and down here is the convention center where our on-site medical clinic is, where the loading dock is, where we get all of our shipments, and also where the practice courts are. So some spaces are completely ours, others are not. At the Grand Floridian, for instance, it's a very big complex. Part of it is dedicated to the NBA, other part is Disney vacationers, but we set up our perimeter such that there's no interaction between the two. So now to dive into our health and safety protocols. We start with the core principles of how do we keep people healthy and safe. Well, number one, we test every day. Everyone who has that green credential, they're being tested every day. Masks are required for everyone. For our pediatric guests, we're enforcing a policy above the age of 5, and that's working out. And social distancing. We have lots of stations, hand sanitizing stations all around, as well as baskets where people can get a mask, get hand sanitizers, or packets of Clorox wipes to wipe down surfaces. We don't allow guests in the rooms, aside from those who are authorized. Just recently, after the second round of the playoffs, we've allowed players to have a limited number of family and guests. And in that instance, they can have someone in their room. But for all the rest, there's no guests allowed into the rooms. Lots of cleaning going on the campus. All of the high frequency touch points are being wiped down, handrails, buttons, table surfaces, etc. And then we ask our guests to complete a daily symptom check. In terms of housekeeping, they're, again, Disney cast members, we keep a separation between them and everyone else. They're on a schedule. They don't clean every day. They come every few days. I believe it's every 3 or 4 days that they come around. They make sure that we're out of the room. There's limited interaction. They're in masks. They have strict cleaning protocols that have been vetted by industrial hygienists, both on the Disney side and the NBA side. In terms of laundry that needs to get done, we have a contactless system that's there. And then to get around on the campus, there's no Uber, there's no Lyft. You have to take NBA designated transportation. We have buses, we have vans, we have shuttles. Our drivers are tested every day. They're in masks. Anytime there's transport, they're wiping down and cleaning. And so we have a really, really neat system that's organized to keep everyone in the bubble and safe for any of the jobs that they need to do there. When you check into the bubble, everyone gets a nice little packet that has a thermometer in it, a pulse oximeter in it, and information that tells them about the amenities on campus, but also instructional in terms of things like their daily symptom questionnaire. We have everyone download the NBA My Health app, which has a list of questions that people answer every day. Those reflect the signs and symptoms related to coronavirus. If you have those, you say yes. If you don't check off a box. The thermometer and the pulse oximeter Bluetooth the results into the My Health app. So we really harness the power of technology to help us with this process. And there are other pieces to that. Now I'll go into a little bit more detail here. So each day we test. BioReference Lab is doing our testing. The test results and the information from the My Health app are fed into the Fusion database, which we can monitor. The results from the thermometer and the pulse oximeter feed into the My Health app, which goes into Fusion. And then what we've done is we've harnessed the power of the Disney Magic Band, this thing right here, which for those of you who've been to any of the Disney complexes know that this is your room key, but this is also a method of payment. But we've taken it a step further and using this as a way to allow people beyond our various checkpoints on the campus. We also give people a Connect-On device, which is a proximity alarm, this thing here, and it's connected to your credential. If you are within 6 feet of someone for more than a few seconds, it makes a very obnoxious sound. And that's just a warning, hey, get back, keep your social distance. For those who can't exactly judge 6 feet, we'll help you out. And finally, an optional piece of technology, the Oura Ring we have for COVID symptom monitoring. That's more for research purposes, but that's something that's available as well. So how does this all work? Do your test, do your symptom screening, temperature check, pulse ox, verify you haven't been around anybody with coronavirus. If all of that checks out, in the Fusion database, it registers as green. So when you get to a checkpoint, you hold up your Magic Band to a Magic Band reader, and it'll scan green. Green means you're all clear. You can proceed, you can get on the bus, you can go into the arena, you can go into the dining area, whatever the case may be. If it doesn't scan green, scans blue, that means something's up. At each of these health checkpoints, we have what are called health monitors. And these are individuals who can look in the Fusion database and see what is wrong. Did someone forget to do their symptom screen? Did they forget to check their temperature? Did someone's test come back positive? Any of those things would register as a blue, and that would mean you can't proceed. In the event that someone did test positive, we have isolation rooms at each site We have PPE at each site, and the health monitor would contact the physician who would move on to assist that person and notify them about that positive test. In terms of testing, BioReference Labs has set up a very good testing procedure for us. When teams come in or lots of staff come in, we have seats that are set up nice and spaced out. The first row 1 through 4, stations 1 through 4 is where you check in. In the picture on the right, you see the cube with the gold ring and a white. That's a Magic Band reader. You can check in right there. You'll see that the workers, they're wearing Tyvek suits. They have on masks. They have on face shields, appropriate PPE. They got on gloves. After you sit down and you get up to move to the next station, someone cleans off where you had just been. At the next stations, 5 through 8 is where you get your test. We're doing pools tests. It's a nasal swab, mid-turbinate. We don't do the nasopharyngeal. We don't go all the way up to the brain, but it's a mid-turbinate swab in each nostril. And then there's a second swab that is an oropharyngeal or mouth swab. They take those two, put them in a viral transport medium, and they send that off to the lab for testing. I told you that we do have pediatric guests who are on campus, and we recognize that they need a different environment. They need to feel comfortable if they're going to be tested every day, and we've set that up, and Disney has been great in helping us to execute that. They get their test, and they get prizes when they test every day. For each tickle of the nose, as we call it, they get a prize. So every kid, every day, will walk away with 2 prizes, and they love that, and our participation has been great. No kicking and screaming. So what happens if someone does test positive? Well, first off, we move them to their room or into some type of a quarantine situation. The next thing is that we need to verify that that positive test is indeed a true positive test. The platform that we primarily use is the Roche Cobas, and one thing that we can get from that is not just qualitative data, but quantitative. We look at cycle thresholds to see what is the inoculum, how much viral RNA is present in each of those swabs. And if someone has a very low cycle threshold, that means there's lots of viral particles that are there. That means that that person is very contagious. If it takes lots of cycles to amplify that nucleic acid, then that means that that's probably more viral debris than active virus. But we want to confirm that this is a true infectious positive case. We do recognize that there are false positives, and we want to make sure that we're not putting people in quarantine or isolation unnecessarily. But we also recognize that some people have been exposed to the virus before or have tested positive before and will get these lingering positives that pop up from time to time. In order to be cleared from isolation if someone does test positive, we are following the CDC's test-based strategy, which is 2 negative tests 24 hours apart. What we've generally seen is that it takes about 20 days for someone to go from testing positive to generating those 2 negative tests. We do have separate isolation housing that is off campus for anyone who does test positive. Those people get a daily check twice a day from a nurse who goes through their symptoms, checks their vitals, and just makes sure that they're doing okay. We make sure that their meals are taken care of, that they have access to clean linen and things that they need. It's really important for us that when someone is in isolation, that they're not isolated. Everyone has access to a clinical psychologist who we have on campus, and we make those services available, and I'll talk more about what medical resources we do have on campus. For the players and our officials, if they test positive, following guidelines from the Cardiology Association, there's a period of convalescence that they have to undergo, and they have to undergo subsequent cardiac clearance. And that cardiac clearance involves an ultrasound of the heart, an echocardiogram, which we do as a resting echo, an ECG, looking at their heart rate, rhythm, and signaling, and a troponin test, a cardiac biomarker. Once they've passed that screening, then they're cleared to return to competition or the court. One frequent question that we get is, how is it that if someone tests positive, the people around them don't have to go into quarantine or isolation? And part of it is because of the testing strategy that we have, which is testing every day. In testing every day, we hope that we're able to capture early enough someone who has turned a positive test but may not quite be infectious. And that is actually borne out, and that's what we've seen through our experience, that when someone has tested positive, that the spread has not been there. And so that daily testing has been a benefit for us. And for those individuals who have been exposed, as long as they remain asymptomatic, then they can continue to proceed. And they're being tested too. So even though they've been around someone who's been exposed, we do our due diligence. We have a team that's dedicated to contact tracing and assessing whether or not those exposures are high, medium, low risk. So lots of work goes into how we're able to continue our operation in the event of a positive test. So talking about the medical resources that we have on campus. Again, I told you we partnered with Advent Health. They're our designated hospital. The Celebration Hospital is about 5 miles away from campus, and that's where we go if we have an ER need, if someone needs to have surgery. We have had cases where people have required surgery, or subspecialist care. We go to Advent Celebration Hospital. We also have analyzed the local trauma centers and made contact and relationships there. Advent has been gracious enough to tie us into their concierge and VIP program, their care advocate program, and they've been great. On our campus, at the Coronado Springs Convention Center, we have an on-site medical clinic that functions as an urgent care. It's open from 8 a.m. to 10 p.m. every day. We have doctors, we have nurses, we have x-ray and ultrasound with technicians for x-ray and ultrasound who are here from 8 a.m. to 10 p.m. We're able to do IV treatments and fluids. We have basic medications that are available in the clinic, and they help facilitate some of the prescription needs that we have. Aside from the on-site clinic, we have my group, the Event Medical Group. We've had 5 to 6 doctors here at a time. The doctors and medical providers in Event Medical are of broad backgrounds. We have sports medicine physicians, emergency physicians, internists. We have Dr. Sarge Tucker, who's here. He's triple board certified in infectious disease, emergency medicine, and internal medicine here in the bubble with us. We have family medicine practitioners. We have Tim Wolf, who's a fire captain and a paramedic and a SWAT member. Harris Patel, who's a physician assistant and an athletic trainer. And so we have a very robust medical group that's here because we have a wide variety of people, 1,600 people in the bubble who we need to take care of and things come up. Aside from the Event Medical Group, we have team physicians who are here. Some teams have brought their own physician, but other teams weren't able to travel with their team physicians. So we have orthopedic surgeons and medical providers taking care of multiple teams, and we have a large group that's here servicing those needs. Aside from our physicians and nurses and the providers through Advent who are here, we also have resources that are available for those who are staying off-site, those with the yellow credential, so that they have access. Advent has 2 urgent care centers on the Disney property, one in Orange Lake, one in Lake Buena Vista, and we've made arrangements for transportation to those urgent care centers and expedited access for those who are here. Aside from that, we wanted to make sure that we address the whole person. So we do have access to virtual chaplains. As I mentioned before, Dr. Derek Anderson, he's a clinical psychologist who's here in the bubble and available for services, but in the event that things get too busy for him, we've also set up for telemedicine consultations for general health, as also for mental health and behavioral health. So lots of medical resources that we put in place to make sure that we're addressing the needs. One thing we've set up is all of these medical resources so that we don't have to leave the bubble, recognizing that there's lots of COVID cases in the community. When we started our planning in May, Florida didn't have the number of cases that it had in June and July when we showed up. However, we felt very comfortable and confident in the health and safety protocols that we had in place, that we felt that we could still come and have our event, and that has borne out, that our protocols have stood up. But in the event that someone does need to leave the bubble and go over for consultation, whether it's dental or otherwise, we have come up with a clean corridor process that's been signed off by our infectious disease experts, our epidemiologists, in consultation with the NB Players Association, the NBA, and Advent Health, to make sure that if someone leaves, that they're taken care of, they're protected, and that we're not taking undue risk. In some instances, when someone leaves the bubble, they need to quarantine, and that time of quarantine will vary depending on where they went, how long they were out, and what their levels of exposure were. So finally, the campus experience. As I said, we're at the ESPN Wide World of Sport Complex. They have 3 venues with basketball courts that we use. The Advent Health Arena is the primary broadcast court, the Visa Athletic Center, and the Field House. But you can also appreciate there are lots of other sporting complexes there, baseball diamonds, a track and field, as well as soccer fields. When we first got here, MLS soccer was here, and we had to share the grounds. But this is where most of the business takes place. This is my last slide here, but showing you how we bring it all together. So this slide shows you the various colors of the credential and how they access the facilities. Notice that the team, they have green credentials. They come in through certain doors. There are Magic Band readers there in case a player or a staff member has forgotten to do their questionnaire or reported symptoms. We can capture them there before they proceed and interact with others. Those with the yellow credential, they go in one entrance of the building. Those with a green credential on the staff side come in a different door. The MD is the Magic Band reader. And you can see we just structured it so that we minimize any potential for cross-pollination, that the yellow credentials won't be able to interact with the green credentials. On the right of the screen, the BOG, our Board of Governors, or SLT, Senior Leadership Team, they're on the upper deck, whereas the game court and the green credentialed individuals, including family, are on the event level or the lower deck. At each of our games, we have EMS present. We have paramedics who are dedicated to the court. They're there, our paramedics, they're being tested daily. We also have first aid and EMTs who are also in the building. And so on the ESPN Wide World of Sport complex, we have that first responder presence. Also on this campus, on the Wide World of Sport complex, we have an MRI scanner, 1.5 Tesla magnet, and a CT scanner. Again, trying to make sure that we have all of the resources that we need as best we can in the bubble to minimize people needing to leave the bubble. In each one of our arenas, we have an X-ray machine and a technician. And in the arena, the Advent Health Arena, we do have a portable ultrasound machine that's available for the team physicians as well. Some of the team physicians travel with their own portable X-ray ultrasound machine. So that's a look at the bubble as it's defined, what we're able to do, how it's all brought together, the integration with technology, and it's working. I'm very proud of the work that we're doing. We have been successful, but I'm not resting on the laurels where we are because we have to get to the end. We still have more than a month of basketball left to play, and coronavirus is just around the corner. So we have to be careful not to get that Rona and do what we have to do. We have to stay compliant. The speech that I give to the players when they first arrive is that they are here for basketball, and the court upon which they are playing is built on compliance. We need them to do what they're supposed to do. I'm doing my job, you do your job, but you also have my back. And so in doing so, I think we've created a safe environment. It's been a huge effort, lots of collaboration, and I'm just hoping that we can get to the end, and I'm pretty confident and comfortable that we will. I'd just like to give a special thank you to my wife, Melissa, my daughters, Noemi and Kalia. They have been so supportive. They've endured daddy being away from home. And even when I have been home, early morning calls, taking up space, they've just been very supportive. And I just have to take time to say thanks. They've done the best they could in the setting of sheltering in place. They've been creative. They've been active. I love you all dearly, and I can't thank you enough for allowing me to be here to do this. I can't do it without your support, and you know that. Thank you all. And that's it. I know I went long. Sorry.
I don't think it was long at all. It was fascinating, Leroy. Thank you so much for that. Now I want to kind of handle some of the questions, many of which you touched on some of the answers in your presentation. But let's start out with one that is about being consistent. So how are you supervising and monitoring all these risk mitigation practices to ensure they're being done consistently? We need your perspective for monitoring protocols and practices in our school now. It sounds like you have tremendous cooperation from the professional athletes themselves, and you also have this magic Disney wristband. Do you have any suggestions about how you've been able to keep the consistency of people following the procedures, and whether there's anything to transfer on that for kids that are in school.
Yes. I think one of the most important things to have is dialogue and communication, and over communicate. You have to let people know what your plan is, why that plan is in place, what the importance of those plans are. Field the questions for people who doubt the importance or the significance of what you're doing. So the communication goes a long way towards execution and compliance. I think something else that's really important is that you understand what the needs are of the people on the other side. As I say, with our testing program, the pediatric testing room looks very different from the adult testing room. You have to keep in mind that different stakeholders and personnel have different needs. And so that's something else too. You have to visualize what it's going to take to get people to be cooperative and compliant. You need resources. You need lots and lots of resources, personnel, time, and that's what we've seen. When we started here, there was me, Dr. Rogers, Dr. LeMay, and we quickly knew that we're going to need more people. So you need more bodies. And so, you know, for schools, I think you look into harnessing your network. You look to get buy-in. Where we started, we continue to add, we continue to refine our processes. What you can't do is have a rigid plan that's not malleable. You have to be able to adapt to different circumstances. Think about how things worked in the United States. When this virus and the pandemic first started, the first thing that we were told was you're only at risk if you went to Wuhan or you were around someone who went there, that this can't be spread person to person. But as we got more information and more data, things changed, our perspectives changed. And it wasn't a flip-flop. We're doing it methodically and based on data and information. So you have to be able to adapt, and that's there. And so I think those are some of the strategies that are important to have in place to get to that point of success and operationalizing the protocols that are trying to be put in place. Thank you for that question.
We had a few people who, and you may or may not be able to share this information about how many people in the bubble have tested positive. You did say this is what happens if they do test positive, and how many get quarantined or isolated.
So you're right, there's some information that I cannot share. There's more information that we'll share at the end. But what I can say, the information that is shareable, is that once we put our bubble in place, we've had no players who tested positive. We've gone, I think we're at week number 6 with no positive. And so, you know, keep in mind that we have various levels of people who are here who are being tested. We have players, we have reps, we have staff here, team staff, but we also have Disney cast members who are testing, who are coming and going. We have our drivers, we have EMS, and then consultants who are testing before they come into the bubble at times. You know, have we had some positives? Yes, not many, which again is a testament to what we're doing. And so, you know, I can't give the specific numbers. We will get to those, but in terms of the key stakeholders, our staff and players, we're doing pretty good.
Great. There's 2 or 3 questions that run around the issue of the psychological kind of state of the players, both in dealing with the bubble, dealing with being away from their families. Are they playing differently or having any psychological effects because they're not in that, you know, high charged fan environment? And then third to that, also having to do with mental health issues, is around the Black Lives Matter movement. And so as you talked about that there were mental health support there, but could you talk a little bit more about isolation? How does it affect their game? How does it affect their relationships with families? And how has Black Lives Matters movement affected them?
All right, let's try to unpack that one. Thank you. Thank you. That sounds like a Stanford question. Let me get 3 questions in one. So first off, as I mentioned, in setting up our medical infrastructure here, we did take into account mental health resources that would be needed, which is why we have a clinical psychologist who's here, but also mental health providers who are available to those in the bubble, recognizing that not everyone would want to talk to the NBA's clinical psychologist, that they may want to speak with someone in terms of anonymity. For that reason, we do know that sometimes there's a stigma that's associated with mental health. So we have chaplains who are available. Maybe someone wants to have a conversation in that context, and that works. So we set up those resources for people here to have, and that's just a part of it. As much as we're focusing on medical, we have to remember that the mental health is just as important. Keep in mind that we are at Walt Disney World, that there are amenities that are here. The players have access to fishing, to golf, to pickleball, bowling, movies, etc. So there are amenities here that, even though they are on this campus and isolated, that is not the drag that some of them thought it would be. And they've said that. I've had players come to me like, this is way better than I thought it would be before I got here. Also, what you have to keep in mind is players were allowed to opt out. I mean, there were financial implications to some of that, but there are players in the National Basketball Association who are not here. So that was an option. Some people looked at their health, their risk profiles, or whatever it may have you, and they made the decision that they weren't going to come. So players had to make that decision in conjunction with their teams. So yes, there is some isolation. How has it impacted the game? These are ball players, and anyone who plays the sport knows that it's just competitive. When they step on the court, they compete. Whether it's I'm better than you. I'm going to show you what I've got. And I'll give you an example. I mean, take Phoenix, one of the teams that was lower seed. They went undefeated. They came here. What are they playing for? They played. They competed. They played hard. And so we haven't seen a detriment to the game based on the fact that these players are here in a bubble and away from their families. One of the other things is that they knew at some point that they would be allowed to have guests, and we negotiated that when we would allow guests. One of the things that was important for us is to make sure we had the bubble intact, that we could sustain it before we can welcome others in from outside. But we had a discussion and a negotiation with the Players Association. One of the things that they were very firm on was, we're not going to go 3 months without seeing our family. So that was there. And like I said with the previous question, you can't hold up a protocol saying you're going to come to the bubble, no guests whatsoever, and think that that's going to fly. You have to have a dialogue. There's going to be some negotiation, some give and take. So we now since the second round of the playoffs has concluded, there are player guests who are on campus. And it is refreshing to see strollers and kids running around. And it creates a different environment and a more communal feel. And so they have some of that. So I haven't seen a negative impact. There's been a lot. I mean, there have been some great games, really great games. Guys are playing hard. We haven't seen an uptick in the number of injuries, more so than we normally would at the start of the season or mid-season. So that hasn't seemed to outpace what the historical data has been. So, there's that. Now, in terms of Black Lives Matter, that was an important piece of this process, that the players have a voice, have a platform, and they can use that. 2020 has been something else. 2020 has been something else. There's a pandemic. There's this social injustice that's going on. There's what's happening to people who look like me. And I feel it. They feel it. And it's important that they're allowed to address it. And we went through discussions of how to do it, how to allow players to have a voice, how the players could use their platform to continue to contribute to the movement. Remember, there were players before saying we shouldn't even go because going down to the bubble is going to detract from the movement, from Black Lives Matter. But on the whole, they, as a group, decided that they were going to come here and leverage their platform. Their platform is basketball, but have a voice. They negotiated the Black Lives Matter message on the court. That's being seen every day. Everybody, they don't love that, but that was something that was there. The messages on the back of the jersey, that's something that the players wanted to have. Taking the knee during the anthem. All of those things, the players are there, but also making sure that they have buy-in from others. And we've seen what has happened when players leverage that. We had the Milwaukee Bucks, after what happened in Kenosha, say, we can't take the court. Like, we're not there. We're not in the mental space. And so if you're asking the question, how has the movement impacted the players? It impacted them. They didn't stage that. They got in the locker room ready to play. The Magic were on the court, and Milwaukee said, we're not there. There's something bigger than basketball that's going on, and to that end, now is not the time to be playing. Let's figure out what we want to do. And I applaud those guys for making sure that they're making a contribution, for getting buy-in from the governors and a team leadership and ownership, thinking about things like, how do you de-escalate? How do you get better engagement between law enforcement and the community? How to reduce or just get rid of this violence, like just going straight to deadly force. And so these are the things that the players are interested in. They're using their voices, their platforms, their resources, their networks to make sure that they are speaking to the movement. And so from that point of view, the players are active, they are engaged, and that's a piece that was really important to them. And I'm very proud that they're allowed to talk about that and to express themselves, because some of this has happened to them. We've had players who have had interactions with law enforcement. So on some level, it's about the movement, but on some level, it's personal. And so, I think that we do have mechanisms in place. What I'll tell you is, the day after the Bucks, a day or two after the Bucks didn't play and we stopped playing, the impact reached the WNBA, other sports leagues started not playing games, and we had a community conversation. We didn't let that moment just sit. We talked about it. We gathered as a group, the people in the bubble. Let's talk about this moment. Let's not let this pass and not address it and not make an action plan. And that's the thing I think that the NBA does really well. It's not just lip service. It's not just throwing money at situations. It's being engaged. It's being active. It's really trying to make a difference. And that's why I'm so proud to be a part of this. But we got to hold them to task. We have to make sure that all these individuals are doing what they need to do to make sure that change is coming about. And we need that. Thank you for that triple question.
Terrific, Leroy. And I think it's, a testament to the fact that they may be in the bubble, but that doesn't mean they're not aware of what's going on in society and other issues that have always been important to the players. So that's terrific. We have a couple of questions of people saying how, or do you have any thoughts about how the kinds of success you've had with the NBA could also be translated to college sports?
So that's interesting. There are some things that will have to be in place. I mean, testing obviously is one of them. It's somewhat different because you're talking about the NBA, where these are professional athletes who are being paid versus student athletes. So the considerations, it's not an exact apples to apples comparison. But what I do know is that they're doing some of the same things that we did, which is they're having communications and discussions with experts and consulting with the various leagues about what have you done. Remember, for us and for college sports, there's no playbook. There's no pandemic playbook that you can turn to of this is how you hold your sports season in the middle of a pandemic. And so they have to be smart and methodical about what their approach is going to be. I'm not involved in those discussions, but you do know that you're going to need some degree of testing. You're going to need a very robust cleaning program. You're going to have to get buy-in from the players, from the athletes. And, trying to get professional athletes who are being paid may look different from college students. But again, we talk about competitiveness, we talk about motivation, and student athletes or people in general, sports is a livelihood. Sports is therapeutic. Sports brings us together. So I think that the NCAA will have to come up with their plans, have those plans vetted, get sign off from the local authorities, whether it's departments of public health, consult the experts, and make sure that they can do it safely. At the end of the day, sure, they can say we're going to go forward, but the question is, can you go forward safely? Can you keep those students safe? Can you say to those mothers and fathers and grandmothers and grandfathers that you don't have to worry about your kid when they come to play? It's tough. You know, the decisions that I was making at 18 to 22 and the regard for, you know, my health, you know, is very different from the decisions that I make when I'm older than that. And you have to keep in mind who your people, who the people are, and how do you get that buy-in from college students to recognize that, hey, you can't take these chances if this is what you want to do. So there needs to be discussion. I think you've seen some of these college athletes coming together, using their voice, and holding the various sporting leagues and conferences to ask about, hey, we want this done, but if we're going to do it, these are our demands. And I applaud them for getting together and making that known. But it has to be collaborative. It can't be just one conference saying this is what's going to happen. You got to have buy-in from the players, and you have to have the resources, the staff to execute. So, you know, I think the NCAA, hopefully they're going to proceed with caution and have a robust plan. They have resources, so I have confidence that they would be able to do it should they go forward.
Perfect. Okay, this is kind of our final question.
Already?
Just, you touched on it a little bit at the beginning about how you've been able to reach out for resources, but what in your Stanford experience and training do you think really has helped you go through this very unique situation and your role in professional sports in general?
That's a great question. And that's one I think of. You know, in everything that I do professionally, I mentioned Stanford. I remember Stanford. I had a great experience at Stanford, start until now. My dorm experience, my experience as a walk-on athlete to the track team, the support I got from my mentors and advisors, the faculty, the ability to engage in research and explore different fields. There was a lot that went into it. The friendships that I developed, the people who I have around me, the people who are in my life now, a lot of them are tied to Stanford. This opportunity that I have right now is tied to Stanford. Becoming a team physician with the Golden State Warriors is tied to Stanford. And so what Stanford did was it allowed me to grow. It allowed me to take chances and risks in a controlled environment and encouraged it. Stanford gave money to pursue research, take a chance, come up with an idea, we'll give you money to fund it. And so the things that happened to me at Stanford were just that. Like I was pushed by smart individuals to not only stay on top of my work, but to be the best and the brightest. I was surrounded by people who encouraged me to go further, that you can do it. Even when I changed my mind, once upon a time, I really wanted to be a neurosurgeon. And that was something that was built into my identity. And when I made that decision to not do it, I still had the support of the Department of Neurosurgery, emergency medicine, my friends, my family, and Stanford was there. It's that support. The Center of Excellence was there to support the idea that I wanted to be engaged and involved and given back to the community. SUMA, the program that brings together underrepresented individuals who have an interest in medicine and being able to be a part of the SUMA program, the HCOP program, the pipeline, Arbor Free Clinic, all of those things, that East Palo Alto tennis and tutoring. Stanford put all these things there to say, hey, you can pursue the academics, you can pursue the athletics, you can be involved in community service. Stanford put all that there, and it said, it's here, now go for it. And it gave me that tailwind, it pushed me forward, and that's what I took from it. If the resources and opportunities are there, take advantage. And Stanford said, we'll give it to you. Now you have to take advantage, show us what you can do with it. And I think that where I am today is a testament to what Stanford provided, the support that I got from faculty, colleagues, friends. I even got a wife out of Stanford. So Stanford's been there, and I'm very, very proud of the opportunities that I had at Stanford, for the support that I was given and the support I continue to have as a result of Stanford University Stanford School of Medicine, and the alumni, friends, educators that I've come across. So Stanford's been great. I applaud Stanford for helping me get to where I am, and I thank Stanford.
Thank you. So I want to once again thank Leroy for his wonderful presentation and the MBA for allowing this evening's presentation. We have recorded this session, and it will be available on our website probably at the beginning of next week. You will also all receive an email survey asking about your experience in today's seminar and providing us with feedback so we can continually do those improvements, just as Leroy does in his protocols. Please join us in November when Dr. Ian Tong will present on the rise of telemedicine, and information can be found in the coming weeks on our website about these and other future alumni to alumni seminars. Thank you again, Dr. Leroy Sims. Thank you, audience, and good evening.
Thank you.